morning, and welcome to another episode of Ask the Healthcare Advocate Live, where every Sunday morning between 8:40 and 9, I answer all sorts of questions related to healthcare advocacy in Israel and sometimes abroad. And today, it is with a heavy heart that I do this live. I can't say that I'm at my most perky or upbeat. Definitely a very painful thing that has happened to us in Israel, and we all are kind of, I think, trying to wrap our heads around it. And I'm sure that many of you know personally. I hopefully that nobody in their own families, but we all have people who were there who experienced some level. Either they knew it was going on, or that they didn't get there before, or they were there. And I was talking to a friend of mine who I was in touch with just because I just assumed that she had children there because it just she always has kids who go to Meron, and she told me that she had a son who was there who wasn't. Thank God he was fine, but he was in the place where he watched them bring the bodies and the injured people to. There wasn't really a choice of being able to move around then, a young boy. And she said, I'm sure that he's going to have, trauma from this, which got me to thinking that what can I talk about this morning? And that's why I decided to focus on trauma. What do we do? What are our resources in Israel for English speakers about getting sort of crisis mental health support that we need? So first of all, it's important to remember that it's important to get help and not to sit with the trauma. Anytime any of us see, even just witness this level of traumatic event that is so outside our realm of normal, it affects all of us differently, and that's important to remember. Some people are able, it's not a matter of able or not able, I shouldn't use those words, just some people process difficult things in different ways. And I was actually helping a psychiatrist edit an article that he's written on creating a sort of a type of questionnaire or evaluation where you can predetermine whether children are going to be predisposed to developing PTSD after a traumatic event. There's just a host of characteristics that we're not even really aware that we have until the moment. So again, we're not ever sure how we're going to respond, and we don't know exactly how our children will respond, but it is important to be aware of that so that if anybody had someone that they know in the situation who was witnessing what was going on, even just even if they didn't see anything happening, but even just seeing everything that is going on around you can be really traumatic. So the first thing that I wanted to mention as a resource is that because of Corona, the Kupat Cholim have put into place the ability for everybody to have three telephone meetings with a therapist. Every kupa, if you call up the main number, you sign up. They're actually very good about it, and they would contact you pretty quickly. And there is an option to request somebody who speaks in English. Now, I can't tell you what the level of English will be, but for sure. So that's the first resource to do for you or for your children or somebody, is to make sure that you access that resource. It's 100% free. It's really easily organized. It's over the phone, and it can be very, very helpful. So that's very important to do. The second thing is to know that there are all these hotlines that you can call up for children. One of them is a RAN. It's called a RAN. It's a crisis hotline. I'll put the number in my comments. And they did say, I have spoken to them, and they do say that they have English speaking volunteers, so that if you feel that your child is in crisis at that moment, or is feeling you can see that something is going on. So then make sure that you reach out so that you can talk to somebody. Pretty quickly. Also, there are trauma therapists. There are trauma centers There's Kavla Noel, which has a crisis center. There's something called Headspace, which is also in Jerusalem, which is free for Jerusalem residents, as well as there's one in Bat Yam, and they're specifically for children and adolescents, specifically for things like this. So not more complicated mental health disorders, but things when your children need to work things out, especially if they've seen something that was difficult. At the very least, it's important to bring it up. It's important to have the discussion. It's important, even if your child doesn't want to talk about it, it's important to ask how they're feeling. And it could be that your child wasn't there, but that your child knows somebody else who was there. So give them an opportunity to talk about it. And it's really okay for a child to sort of go through a list of facts. I knew this person who knew that person who was hurt, or that person, I found out that he was underneath other people for 10 minutes. It might sound a little bit gruesome, but it's important to let the child have that type of processing, because that's actually a normal response. Sometimes you go through dry facts and you don't let yourself, the emotion comes later. So let your child or your loved one, it could also be a cousin or a friend or a spouse, who let them sort of have their own way of processing, and just keep your eye out to see if after a week or so that there's different behaviors, or there's not re-engagement in day-to-day sort of scheduling in life, and make sure that you give an opportunity for the child to, or the adult, but especially the child, to have a place to talk about those feelings, because they can be very overwhelming, and you can be removed from it and you're still very affected. So it's important to remember that. So again, as always, if you've got any questions, feel free to send me a private message. Feel free to send me a comment also in the on this video. Thank you so much for joining me, as I do this every Sunday morning between 8:30 and 9. Feel free to send me your questions if you want me to address something, and we'll see you next week on Ask the Healthcare Advocate Live.